I'm Elizabeth Avila, and I'm at the University of Kansas School of Medicine in Wichita. I'm an associate professor in the Department of Preventive Medicine and Public Health. Whirlpool, Kansas really is fervent in believing that good health is good business. And so if we think about productivity, that's a really big component of a wellness initiative. We see consistently that employees are reporting that they're more productive as a function of having participated in worksite wellness. But we've also seen outcomes such as less absenteeism, lower healthcare costs, improved retention and recruitment, and improved morale. And even one of those, when that changes, it changes the culture of the worksite. And that's a really exciting place to be.
About a decade or so ago, as health insurance costs were just going through the roof. And we kept saying, goodness sake, how are we going to be able to do this? And one of the suggestions is, well, you need a wellness program. So if your people are healthier, you're going to spend less on health care, premiums can go down, which the employees share in too. So it's win-win-win. Everybody's better. About 2 years ago, we got a little more serious and said, you know what, we're going to make it a tobacco-free campus. That one's such an obvious. It's got a financial impact that's immediate. And at the same time, I know that's a really difficult thing. And so we need to come along beside and help.
In June of this year, we just enacted an active meeting policy. A lot of research that's coming out is trying to get people to get up and move for every 30 minutes. So if you have a meeting more than 30 minutes, to get up and move for 2 or 3 minutes, or just stand during the meeting.
We're one of the largest employers in the county. We have 400 employees, and they're like family to us. And that's how you want to look at it. But at the same time, we have to have insurance, we have to have benefits, and we have to pay for all of that. So all the different programs that we can put together, like the active programs, are ones that we need to do in order to provide the tools that are necessary for people to take care of their own health.
All of the interventions that we propose to work sites are all based on research. So we want to make sure that we are bringing those types of interventions to work sites. So we give really the best chance that we can to employers to really improve their environment.
I think our original impetus was taking a look at it from a health insurance perspective, what we could do to help control costs. A significant part of that would be looking at what we could do as an organization to promote wellness among our employees.
We've implemented a lot of policies over the years. The one that was probably the biggest challenge, and that is fairly new, is the food and beverage policy that it talks about making sure that employees, when we're spending money, KU endowment money on our employees for food, that it fits certain guidelines. We like fiber, we like fresh fruits and vegetables. We don't do soda or any kind of pop. Those are some of the basics of our guidelines.
The two most important programs or initiatives that we have within the wellness program probably would be the activity trackers, and then in addition to that, our on-site biometric screenings. As I see other individuals that I'm working with and how serious they're taking their physical activity and their health overall, it has inspired me to get serious about it myself.
Prevention is an investment to be maximized, not a cost to be justified.
If I'd have known I was going to live this long, I'd have taken a little better care of myself. And while we all laugh about that, it's one of the smartest things you're ever going to hear. And if you would learn it, you'll appreciate it.
If someone came to me and they said, we're thinking about starting a wellness program, my first response would be, you're 5 years behind. And you need to get moving, because one of the most important assets in any system is your personnel, is your people. And these folks need to be happy, they need to be healthy, they need to be supportive of the county. And one of the ways to do that is to be supportive of them.
One of the gentlemen who was the head of a credit union said, well, my main message learned today is that I have not been doing anything with worksite wellness and all of my competitors have. So, starting to think about it as what can we do for our employees, but also what can we do for our business?
As we go through and we've been on this journey, we're able to show that we care. As we show we care, we create trust. As we create trust, then it makes our workplace more effective and more efficient.
We know that people in our company like our program, that it helps with recruiting and retention. I think people really feel like we care about them, and I think that goes a long way. It makes it a better work environment.
We have over 500 families represented here that we care deeply about. There's so much benefit to be had from a wellness program to take better care of your health.
It's supposed to be health care, not sick care. So if you treat it as health care and you're treating the cause of the problem instead of treating the symptoms, you're going to look at wellness in an entirely new lens.